conversely, does it also then influence your priorities as it relates to what kind of digital health initiatives that, you should be investing in to serve your population? Can you talk a little bit about that? And start by what kind of populations do you serve?
Yeah, so we serve a very diverse patient population. To some context of around the University of Rochester, a medical center and health system. We're the largest health system outside of New York City, and so in terms of geography, we have a large geography in the state of New York, from central New York all the way out to the Ohio border and all the way down to kind of to the Pennsylvania border. We have patients that we serve, and so in terms of kind of diversity of these patients, we have everything from the inner city of Rochester, which looks like the inner city of most moderate sized cities across the country, but you go 20, 25 miles outside of the city and you could be in some of the more rural areas in the state or in the country. A good portion of our patient population is safety nets and Medicaid. So we have a lot of underserved and vulnerable patients that seek care out at our academic medical center. And so, for those reasons and trying to engage and reach those patient populations, we've had to think outside the box and, think of other technology solutions to, again, meet the needs of our patients in our inner cities, to meeting those patients who, there may not be a specific specialist for 4 counties around them, and how do we get care out to them. In regards to our technology priorities and the influence that the college has on that, actually not a whole lot of influence from the college in the normal sense. We have a very clear digital transformation strategy that's set out, and when we have gaps in our technology stack where we say, hey, we need to solve this problem. We currently don't have a solution in our technology stack, where we may lean on the college and that expertise. Is if we can't find a solution, we can't find an external vendor that's we think best of breed to fill it in, we'll leverage our expertise at the college and say, hey, can you help us develop the solution in-house? And it's not, we don't develop technologies for the purpose of spinning out companies. We don't have like a real true investment arm. So we're different than another one of your honorees like Providence Health, which has a $300 million venture arm where they actually incubate a lot of companies in-house. They invest in them and spin them out. We don't do that. So when we build our technologies, it's truly being built to serve our patient population, to serve our community. And we're actually more likely than not, when we build, to open source our code and give our technologies away to other health systems in the country. And we have a lot of examples of doing that, and other health systems and industry coming in and taking our code and applying it to their systems. So the college, I would say, kind of augments the strategy, but doesn't set it or drive it. They help us fill the gaps.